Welcome everyone to our online meeting on bringing about change for children and families. I am going to be talking to you about how our national advocacy program is influencing care reforms in Zimbabwe to bring positive change for children and families in our country, Zimbabwe. My name is Blessing Mutama, and I'm with an organization called Fost, Farm Orphan Support Trust, which is a local child protection organization that was established in 1995 and registered with the government of Zimbabwe in 1997 to support orphaned and vulnerable children that are in Zimbabwe. We are currently running a national advocacy program on kinship care. As an organization, we realize that kinship care in Zimbabwe is the most prevalent and indigenous form of alternative care, yet it is not given enough recognition in terms of assessment, monitoring, and support of children and the caregivers that are in the kinship care households. So, what we are trying to do as an organization in Zimbabwe through the advocacy program is to take stock, of the support that is currently being given to children and their caregivers in kinship care. We have started conducting a scoping study on kinship care, and the report, the national report on the scoping study is almost out, and it has actually helped us to take stock of the support that is currently being given to children and caregivers who are in kinship care. Then we would also want to map the kinship care policies that are there within our country and see the gaps which are currently there in terms of supporting kinship care. And also the scoping study is also coming in handy to provide us with this information on the policies that are currently available and the gaps that are there in terms of supporting kinship care in Zimbabwe. We also want to influence the reform of the Zimbabwe orphan care policy, and there we would want the government to put in firmer commitments to deliver holistic support, to kinship care. So basically, we are targeting the government so that they actually pledge, to firmly support, kinship care in the policies. Then we are also targeting national networks and child protection working groups to strengthen their capacity to advocate for policy implementation. Sometimes you would have some policies, in a country, but when it comes to implementation will be very weak. Nice policies, but very weak when it comes to implementation. So we want to strengthen these national networks and child protection working groups so that they can advocate for policy implementation, especially those policies that target children and families, in kinship care. Then we've also realized that there are a lot of gaps in terms of the reintegration of children, when they are placed into households under kinship care. We have realized that there are quite a lot of gaps that are there in terms of the assessment of the whole process, the monitoring of the children when they are placed into households, into kinship households, and also in terms of even the support that those families receive. So as an organization, we are advocating for the promotion and dissemination of the reintegration guidelines that were developed by Family for Every Child, and we would like to share these, with the state actors, the practitioners and community-based organizations in Zimbabwe. At the end of our advocacy, we are expecting that the Ministry of Social Welfare will take a lead in reviewing policies such as the orphan care policy of Zimbabwe. This was put in place in 1999, and ever since then, the policy has not been reviewed, and a lot has happened, over time. So there really needs to be some changes that need to be done, on the policy, and we have already started working on reviewing the policy. Then you would also realize that parenting, in the 21st century has become a problem for most caregivers, due to issues such as, the generational gaps, the time that they were brought up and the time that they are bringing up children now is totally different. So, they are having challenges, in when it comes to communication and providing support to the children. And also issues around technology that are also, affecting, our parenting, in the 21st century. So we would want to see children, being better protected, as a result of positive parenting, from carers. And we need to, to provide support to these carers so that they are more resilient, to the challenges, that they face in trying to support children in the kinship care, model. Then one other thing that you would realize is that community support systems have been weakened, by poverty, HIV, all those challenges that we've been facing, in the country. And you find communities are now having challenges, in supporting and responding to the needs of orphaned and vulnerable children. And we would want to see, communities, better placed, to provide stronger support and being able to respond to the needs of kinship care families, that is looking at both the children and the carers. Then lastly, we are working with stakeholders, the practitioners and policy makers. These are the stakeholders that we are working with. Also the civil society organizations. And we would like to see them better positioned, to support the needs of children and kinship carers who are within the kinship care. Why is it that this needs to be done? Why is it that this work is needed? We don't have specific policies on supporting kinship care, like any other alternative care systems. Like if you look at, for an example, I could talk about budgeting. When the government, do their budgeting, there is no budget that is allocated, towards supporting kinship care. Yet we are saying kinship care is the most prevalent model of alternative care for children in Zimbabwe. But now when you look at in terms of financial support and recognition, there really is a big gap there. So we would want, the government to at least allocate a budget, towards supporting kinship care. You'd also realize that the carers in kinship care, they are overburdened. And in the end, they end up experiencing burnout. One of the things that is actually coming out from the scoping study that we've done on kinship care is that the majority of the children being supported under kinship care. They're being taken care of by grandmothers. And you find that these grandparents, by nature of being of their age, they're also vulnerable. So we are actually, putting more vulnerability on someone who has been vulnerable because the system is not well supported. And you would find maybe one grandparent or one granny taking care of eight or even more than 8 children, which puts more pressure on them, in terms of fending for the children. Then in some cases we have had children being abused, in the kinship care because the relatives, they are not getting support, even in terms of probably it could be monitoring, it could be support even in terms of resources, to support the children. So in the end, the children are abused. They could be used for labor, or they could be used, to beef up income. So they would work so that they can beef up income, into the household, into the family. Then children, we've had some children who ended up living in the streets, running away from the places that they would have been placed. And this was mainly due to, lack of support, to the family. Children have got rights, and these are enshrined in the UNCRC. In the Zimbabwe, we have ratified the UNCRC, and we need to ensure that children in kinship care, they achieve, their rights that are enshrined within the UNCRC. Our advocacy plan as an organization is linked to most of the articles that are within the UNCRC, but I'll just share probably 4 that are closely related to the National Advocacy Program that we're currently running. So we have got Article 3 of the CRC, which talks about the best interest of the child, where we are saying, in whatever decisions that we make, whatever support that we give to the families and the children, it should have the best interest of the child. That should be our top priority, that should help us to make decisions and actions when we want to support children. Then Article 4 in the CRC also emphasizes that governments must do all they can, to make sure that children, they enjoy their rights by creating, systems and passing laws that promote and protect children's rights. So we're looking at ensuring that the governments, they've got systems in place, that support children to achieve or attain their rights. And those laws, they need to be, to be passed and implemented. Then Article 18 of the CRC, it states that both parents, they share the responsibility for bringing out their child. And I love the second part, which says, and should always consider what is best for the child. In whatever we do, we need to consider the best interest of the child. And governments must support parents. This is very critical. There is need for the government to support parents by creating support services for children and giving parents the help they need to raise their children. So you'd realize most vulnerable families, they are failing, to properly raise their children because they don't have, it could be the support that they're supposed to be getting, from the government to support, their children. So it's very important that these caregivers or parents, are given enough support services from the government so that they also provide quality care, to the children. Then Article 20 of the CRC, states that if a child cannot be looked after by their immediate family, most of the children that we are talking about here, they've come across situations that result in them being placed in another household, which means that they cannot be looked after by their immediate family. So the government must give them special protection, and assistance. This includes, making sure that the children are provided with alternative care and continuous and respects the child's culture, language, and religion, which is very critical. That the child's culture, religion, and language is maintained. So, as an organization, what is it that we are really trying to call for, in our national advocacy program? You'd realize that most of the children in kinship care, they are struggling to access, their basic rights, rights such as the access to, education. When we talk about education, we're talking about, payment of fees, children having uniforms so that they can also fit with other children when they go to school. They need things like stationery to enhance their performance at school. And even in terms of support for the caregivers to understand the needs of the children and address, these needs in a non-violent manner. I spoke earlier on of issues to do with generational gaps. Like, for an example, when we grew up, we used to be beaten by our parents, and that was their way of disciplining us then. But, the times that we are now, we are encouraging, positive disciplining because we realized, the effects of corporal punishment, how it affects children. So we are saying Zimbabwe needs to create, policy frameworks that recognize, the value of kinship care and promote a full package of support, to the kinship carers so that they are able to address, the needs of the children in a non-violent manner. As mentioned earlier, that there is no budget allocation for kinship care, which in turn, undermines its support, and also the government, does not have enough resources for them to employ enough workers. Here we're looking at social workers and psychologists, whom should be supporting, children and families. We are then calling for the government to increase, investment in social protection for vulnerable families and monitor these schemes. It's very important that they monitor these schemes to ensure that they adequately, support both the parents, the caregivers, and the children who are in kinship care. Our public health system in Zimbabwe has been paralyzed, due to shortages of resourcing, within the healthcare delivery system, and this really makes it difficult for the vulnerable families to access health services. We are therefore calling for Zimbabwean NGOs together with the government to encourage, health systems that recognize the physical and, psychosocial needs of children in kinship care, especially, the older caregivers, the grannies. These days there are issues around mental health that are coming out, and we really need to put in place systems that address and support, mental health issues. We are also calling for Zimbabwe to have systems of child protection and care that protect, children in kinship care and acknowledge the importance or the important place of kinship care in the continuum of care choices for children. One of the things that is coming up or coming out in our scoping studies that kinship care is the most preferred, choice, even by the children themselves. For a lot of reasons. They have identified reasons such as, growing up with your relatives, knowing your relatives, and issues around culture that you'll be able to maintain your culture, you'll be able to maintain your religion, and you feel to belong to a family. So we are saying it's important that systems of child protection and care are put in place, to support children in kinship care, and that kinship care is acknowledged as a very important, model in the continuum of care in Zimbabwe. As we celebrate the 30th anniversary of the UNCLC, we are proud that our national advocacy program is being supported. The national advocacy program that is being supported by Family for Every Child is making progress, on in ensuring that orphaned and vulnerable children in Zimbabwe attain their rights. And these rights basically are the ones that are enshrined, within the CRC. We would like to say, from Fost, the staff, the board members, and the children, happy 30th anniversary. And we are looking forward to a better, brighter future for children in Zimbabwe. Thank you, everyone, for listening and participating in this online event.